Tonight on Children's Hospital, 12-week-old Olivia has a life-threatening tumour that needs urgent treatment.
She's so happy all the time, you just can't think anything bad.
A nasty cut on the head doesn't stop 18-month-old Jacob.
Like this 24/7.
And 11-year-old Bethany is rushed into the hospital with suspected appendicitis. In the heart of the city lies the new Royal Manchester Children's Hospital, one of the biggest and most up-to-date hospitals for children in the country. Its state-of-the-art equipment provides patients with some of the best healthcare facilities in the world, while its medical team of 1,000 work tirelessly to change the lives of children when they need it most. "12-week-old Olivia Dixon is one of the hospital's youngest patients.
Just taking some blood. She's very good. Sleeps like a baby all the way through.
She is a baby.
Her parents, Lucy and John, had only been married for a year when Olivia was born. But their moment of joy soon became every parent's nightmare.
It was a planned home birth. It went absolutely fine.
Faultless, wasn't it?
Yeah, it was. About 6.5 hours long, so I think I got away with it quite luckily. But it was then when they weighed her that the midwife noticed that her tummy was really distended, so yes.
Their new daughter's stomach was very swollen and she was rushed to hospital just hours after being born. Doctors discovered she had a cancerous liver tumour that only affects 1 in a million babies. She's now critically ill.
It's
We
the
were
shock
very upset,
of it all.
weren't we?
It's
You just don't expect it.
You don't think it happens, but it doesn't happen
She
to
was-
you.
She was a
It
week
happens
old.
to other people.
Wasn't
Yeah,
she?
Yeah.
We have had bad days, but we do have to be so upbeat about it and think positively, because it could destroy you otherwise.
Olivia has been having chemotherapy to shrink the tumour since she was just 16 days old.
Right, okay.
The doctor overseeing her treatment is Guy Makin, who's a specialist in childhood cancers.
This is a very big tumour. I mean, her tumour, when she presented, extended all the way down into her pelvis. It was basically filling half of her abdomen. So here's the tumour after 4 cycles of chemotherapy, and it's essentially confined to this bit of the liver, the right lobe. This is the rest of the liver. Before, this was kind of filling virtually all of her abdomen, and her bowel was being pushed right over to the other side. It's a very rare tumour. We probably see 1 or 2 children a year in Manchester with it.
The chemotherapy has shrunk the tumour, but now surgeons need to remove it in a complex operation that could take up to 7 hours.
So it'll all be fine, so don't worry about it.
Brilliant.
I'll come and see you.
Very good. I think we're going to need all the reassurance we can get.
Yeah. Well, it'll be fine. You know, and it's a major operation, but he's done it lots and lots of times before.
In 3 days, the Dixons will be back for surgery that could save their baby daughter's life.
The good thing is, she doesn't know any different.
Yeah, so she's quite
not.
happy.
She's not worrying about tomorrow. She's not worrying about how well she's going to be next week. And she deals with it minute by minute. I think it's us that's all
As long
worries
as she
about
gets fed
things.
and she's got a clean nappy,
Yeah.
she's fine.
Yeah. She's absolutely remarkable. She really is.
The hospital's A&E department treats over 100 head injuries a month. Leading the shift today is consultant Lorcan Duan, who has his work cut out. Energetic Jacob is nearly 2. He's arrived with his mum after cutting his head.
I put him in bed and then heard him screaming upstairs, went up and he was stood there at the door with all blood all over his face. He's rolled over and smashed it onto radiator.
Dr. Duan has decided the wound could be deep, so he's covering Jacob's head with anaesthetic gel to numb it before he examines it properly.
To allow us to assess the wound properly, we need to sedate him, and by sedating him we'll then do a proper clean and closure of the wound and make sure it doesn't open again.
Jacob's got older brother Josh with him for company.
What Jacob doing?
He's having a bandage round his head.
Why?
Why? To help his head. Oh, whoa.
But Jacob's not that keen on being treated.
We'll try again. Yeah, you ready?
The gel will take 40 minutes to work. Staff just have to hope he doesn't escape or have any more accidents before they try to stitch his head.
There we go. It's in your bag. This is Jacob.
Like this 24/7. Surprised he hadn't ended up in sooner.
Because Jacob's so young and active and the wound could be deep, Dr. Duane has decided to use the sedative drug ketamine. It'll immobilise Jacob and he'll feel no pain. The alternative will be a trip to theatre and an overnight stay. Within seconds of getting the ketamine, Jacob's drowsy. Within a minute, he's fully sedated.
You all right, Mum?
No. I don't like it. I'm used to him being loud.
Pretty deep.
The cut is deeper than it first appeared. It's down to the muscle. It needs 2 layers of stitches. But thanks to the ketamine, Jacob's stitched back together in a dream. It's important to keep the room nice and quiet when Jacob comes round.
Just let him recover. In another hour or so, he'll be back to his normal self and he'll be creating havoc.
Baby Olivia Dixon has arrived for the operation that could save her life.
Put her arms up a second. There we go.
She was born with a massive cancerous tumour on her liver, and after 8 weeks of chemotherapy to shrink it, she's having it removed. Mum and Dad hope their nightmare will soon be over.
It is quite scary. There we go. Hold on. She's so happy all the time, and she smiles at you and giggles. You can't think anything bad. I want it to be over and done with, and then she can be a normal baby.
The family have been in and out of hospital since Olivia was born. Tomorrow will be a critical day.
I know Lucy's very worried, and, well, so am I. It seems silly saying that in a way, because hundreds and hundreds of parents have to go through this. Different problems, but the same feelings. It's just gonna be hard.
How are you?
Not so bad.
Dr. Frost from the anaesthetic consultants. This is Dr. Hill, one of my colleagues.
Hi,
John.
Hi.
Consultant anaesthetist Dylan Prosser has the task of keeping Olivia alive during the surgery, which could take up to 7 hours. With 12 years' experience, it's a job he's done many times before.
Basically what he usually says, Mum and Dad can both come down, and what we'll do then, with it being quite small actually, we'll probably get her to go off to sleep in your arms, so you've got a nice big cuddle for her. What I say to mums and dads, if the babies do cry, in a way it's a bonus, because they breathe more quickly, they breathe more deeply, take the anaesthetic on board faster, and they go off to sleep quicker.
I think it's a terrible thing. Children having to suffer things like this. They've not had a chance at life yet. As somebody that's grown up, they've had a chance at life, they've experienced it, they've made their own mistakes or they've made their own successes. That's fine. But a child, they've not had that chance yet. And I think they deserve it. I really do.
You're going in with us, sweetie. Yeah. Oh my God, you're scary.
If all goes well, Olivia could be cleared of cancer.
Can you understand what she's here for today? Yeah.
The fear is she'll lose too much blood or the cancer may have spread.
This is the serious bit. It's got very, very serious now because there is a worst case scenario on the table.
It's 6 o'clock in the evening at Royal Manchester Children's Hospital. 11-year-old Bethany's just been rushed into accident and emergency with suspected appendicitis.
Feel sick, really sick.
At first I just thought it was maybe a stomach bug, and then it got worse.
You okay?
The temperature just went sky high.
To Bethany.
It's up to on-duty surgeon Alex Turner to decide whether Bethany needs an emergency operation to remove her appendix.
What's the pain like? Is it there all the time, or is it coming and going in waves?
It's there all the time, really.
There is no one test that can confirm appendicitis with certainty, so Alex Turner has the challenge of making the diagnosis himself.
Can you point with one finger where this pain is? That's sore, I'm sorry. Could be a number of things, but there's a possibility that this is appendicitis. The appendix sits off the large bowel, okay, and it's a bit like a cul-de-sac on a road, so it's blind ending. And when it gets a bit blocked, it can get a bit inflamed and infected. Now, the treatment is an operation to get rid of it. Okay, so I don't want you to have anything to eat and drink at the moment. All right, see you in a minute. At this point, there's a fairly good chance this is appendicitis. To feel her tummy, she is tender down there, and she looks pretty unwell as well.
I panic when she goes to theatre. If she has to go to theatre, it'll be a mess.
But surgeon Alex Turner is still unsure whether Bethany has appendicitis, so he's decided to delay surgery for at least 24 hours.
Okay.
What we don't want to do is take somebody to theatre and it's a normal appendix, so the best way of sorting that out is just by observing her for a little while and see which way her pain goes, whether it gets better or gets worse.
It's just a waiting game now, isn't it?
Theatre staff will be on standby throughout the night in case Bethany's condition deteriorates. "24 hours later, Bethany's a different child. She's out of bed and her stomach is feeling a lot better.
I'm fine. I felt this small yesterday and this big today. Yep. They say I've got a virus now.
Thankfully, surgeon Alex Turner made the right decision not to operate.
This wasn't a case of appendicitis, and in fact not a surgical case at all.
Yeah.
It's really quite easy to go and do an operation. The harder thing is to know when not to do an operation. It's really just taking a step back, not taking anything on face value.
Yeah.
I feel better than I did. I'm glad she's all right and she's not ended up having to go to theatre.
Doctors believe Bethany has a viral infection, which will get better in time. But now she's being allowed to go home with strict orders to return if she starts to feel unwell again.
Bye.
12-week-old Olivia Dixon is about to have an operation that could save her life. It'll take 3 surgeons several hours to remove the liver tumour that's filling her abdomen. Mum and Dad must sit on the ward and wait.
It is a worry, and it's a long time. Could be so like 7 or 8 hours.
Just depends how it goes.
Okay, now we're all happy with what we're doing. This is Olivia Dixon.
Yes, happy.
Anaesthetist Dylan Prosser is responsible for making sure Olivia's blood and breathing levels remain stable.
The surgeons are working around some very delicate, large blood vessels. And there's always this risk of inadvertently cutting a blood vessel.
The ultrasound scan shows the growth in Olivia's tummy is huge. Finding it won't take the surgeons long, but removing it will be a slow and delicate process.
Find forceps to Mr. Bruce. The other forceps. The micro forceps.
You can see that's the tumour just coming off the side of the actual liver itself. So what they've done is now they've freed up all the connections where the liver connects to the tissues at the back, so they can get better access at the liver to actually take out the tumour itself.
Even though chemotherapy has shrunk the tumour, it still fills half of Olivia's abdomen.
It's about the size of a grapefruit, I would say. Yeah.
So that's the first stage of the operation now. It's gone very well.
Now each blood vessel has to be safely cut when the tumour is removed. Too much bleeding could put Olivia's life at risk.
The main vein was completely encompassed by the mass of the liver, and there's a wee bit of bleeding there.
Olivia is losing a lot of blood, but transfusion is keeping her alive.
So far she's had 176 millilitres, or the equivalent of a third of a pint. The whole circulating blood volume would be the equivalent of perhaps a pint, so quite a significant proportion of bleeding in a child this big.
Okay, it's the tumour resected.
After 4 hours, the tumour is finally removed. Olivia's liver is back in place and there's no sign of other cancerous growths.
Good. Excellent. It's all permanent. Excellent. Music to my ears.
Olivia will spend the next few days sedated in intensive care and will be gradually woken to prevent any further bleeding.
Great.
She did have quite a significant blood loss, probably what amounts to twice the equivalent of her circulating blood volume in the end, which was over a pint of blood. Needless to say, without people donating blood, we couldn't have done this operation. She wouldn't have survived. So today was an excellent day, yeah. Good days are nice. Yeah.
While Olivia is settled in intensive care, cancer specialist Guy Makin can report back to Lucy and John.
She's on ICU, she's still ventilated, she's not paralysed, so she's moving, she's breathing for herself. Their plan is they're going to keep her ventilated for 24 hours.
Mm-hmm. Yeah.
She looks pretty stable.
Brilliant.
Right.
The operation appears to have gone well, but Olivia will need close monitoring over the next year in case the cancer returns.
Been crying, hasn't she?
Downstairs in A&E, Professor Simon Carl is on shift. He's seen a lot of broken bones during his 18 years in medicine, but not many as dramatic as 13-year-old Josh's collarbone.
Just grab a seat there for a second. What have you been up to today?
Fell over.
Fell over, okay.
I reckon he's tripped over his shoelaces.
You've had an x-ray done?
Yeah.
This is impressive, I've got to say. Look at that.
Oh, gosh, look at that, Josh.
Now,
is it broke?
well, you see this bone, and this bone?
Yeah.
They're supposed to be one bone.
Oh, goodness.
So, I mean, that's in a good 3 pieces, then. You can measure that, actually. That bit there should be attached to that bit there. So it's 2.5 centimetres away from where it should be.
Oh.
Now, if that was any other bone, so say that was, you know, like your leg or something like that, there's no way that you'd get away without an operation because it'd have to be put back together again. But the collarbone is very forgiving. And if we can just get those 2 bits of bone to be even slightly close to each other, it'll heal really well.
Yeah.
And, you know, long term, the shoulder should be pretty good. Okay, pop your arm in there, if you can. Sorry, mate.
That's as high as I can get it.
Josh will spend the next 6 weeks wearing the sling. It should be all Mother Nature needs to get the 2 ends back together.
Luckily he's left-handed, so he can still do his homework. Say bye. Bye. Bye.
In the Lake District, 4 months after the operation to remove a cancerous liver tumour, 6-month-old Olivia Dixon is back home with her parents Lucy and John. Olivia's been having regular checkups, but on the family's last visit, a routine scan showed results they'd been dreading.
When she had the ultrasound, they saw that there was another lump in the remaining half of her liver.
It's just a massive setback, isn't it?
It's not supposed to happen like that. You know, it's not supposed to come back, is it?
The same aggressive cancer has returned.
It was clear from the scans that there was a mass that had grown in the other side of the liver. So our interpretation of that is that there presumably was something there before, but it was too small to detect either on the CT scan or at the time of surgery, and that once the other mass was removed and the chemotherapy stopped, that mass just started growing.
Olivia has very little healthy liver left, so for the next few weeks she'll have chemotherapy to shrink the tumour. Then she'll be given a complete liver transplant.
We're getting over that initial shock. We're back to where we were pre-original operation and doing what we have to do.
You never kind of think, oh, well, that's it. Although she's ill, she's like any other child. She still wants to play, she still wants to sleep, she still, you know, it's all those other things you have to think about. So it does stop you from really kind of
getting too down about
it does, definitely.
Yeah.
Our hope would be that with further chemotherapy and with the transplant that she will be okay. The figures for survival after transplantation are good. Certainly we are treating her with the aim of curing her.
Dr. Rishi Sethi is the radiologist on duty. He's going to use ultrasound to scan Harley.
It's quite a nice picture there. This is the stomach, and that's the exit of the stomach, just up there.
The muscle that allows Harley's stomach to empty appears to be larger than usual.
Lengthwise, we usually like it to be below 17 millimetres, and in him it's about 18, 19 millimetres.
Harley has an abnormality. Untreated, his growth will be affected and he could get badly dehydrated.